I've been a veterinarian for 15 years and I've never seen Dr. Dolittle. And while I'd love to be able to talk to animals myself, I'd be really interested to see how accurate the veterinary scene is. It's also known as the butt thermometer scene. So let's jump in.
So, what seems to be the problem?
Well, I tell you, Doctor, I really think it's pulmonary distress. And he might have some fluid on his lungs, too.
Okay, so pulmonary distress. Well, I'm not convinced. That dog looked pretty relaxed. He wasn't panting, he wasn't gasping for breath. He was lying down, looking actually pretty relaxed. I mean, it may be that he's quiet and that he's not well, but he certainly didn't look like he was gasping for breath. So a dog who's gasping for breath and in pulmonary distress, so pulmonary means lungs, they're struggling to breathe. They're going to be typically sitting or standing. They're going to have their elbows spread wide. That will help them suck in as much air as possible. Their mouth is going to be open. Their tongue's going to be lolling out. They're not going to be just cruising like this dog here.
Oh, let me guess. You're an MD.
Yes, I am.
I can always tell when a real doctor brings in an animal.
Oh, a real doctor. So a real doctor, that is going to get on the nerves of a lot of vets out there, especially vets in the US, in America. They graduate with the degree title DVM, so that's Doctor of Veterinary Medicine. They are absolutely real doctors. And to be fair to Dr. Dolittle, he does address this veterinarian as doctor, so he is being perfectly respectful there. It's maybe a little chip on the shoulder of this vet by saying real doctor, and that is something that some vets have. I say kind of it's going to annoy the vets in the US maybe a little bit more, because actually in the UK, so that's where I graduated, where I trained and graduated and worked for a significant part of my career, we actually graduate and we title ourselves as veterinary surgeons. So the difference here is that by being surgeons, if you think of human surgeons, they go from being doctor to Mr. or Mrs. or Miss, rather than maintaining that doctor. So traditionally in the UK, vets have always been Mr. or Mrs. or Miss rather than doctor. Now that has changed recently and a lot more vets are calling themselves doctor. Certainly over here in New Zealand, vets are known as doctors. So absolutely, vets are real doctors. We're just slightly different doctors in the same way that people with PhD, they are doctors. They've earned a doctorate. They're just not medical doctors. So that's really the definition. Rather than real doctor, we can think of MD or medical doctors.
They always like to do a little amateur diagnosis.
Could you tell him to get away from my butt?
If you don't mind. I did go to veterinary school for 5 years.
Is it just me, or is he
does take 5
hovering
years
around my butt a lot?
And unlike an MD, my patient cannot tell me where it hurts.
Listen, seriously, could you tell him my
absolutely
butt
true.
is great?
So, doctor?
It would be really great if they could talk and they could let us know what the problem was. It would be hugely beneficial to be like Dr. Dolittle.
If you don't mind.
Hey, where does he think he's going to put that? Look, I was faking it, okay?
Okay, so mercury thermometers, that's what this guy is using. I think this film was in the late 90s. Yeah, even then, I think we'd probably be using digital thermometers. So digital thermometers, they have a flexible tip, so they're a little bit more kind of gentle with our patients. You don't have to flick them. There's less room for error, and also they're not going to break off. So a glass thermometer, if you've got a particularly wriggly dog, you know, there's going to be a small chance of it breaking. So we use digital thermometers. The other advantage is that they are much, much faster as well. So you're going to get an accurate temperature an awful lot faster, so it's going to be less unpleasant for our patients.
I feel fine. Just don't let him stick that thing up my hello.
And he's not even looking where he's putting it.
Listen to those lungs, shall we?
I'm going to swallow the thermometer, and I don't mean in my mouth.
Dr. Fish, maybe I should pull that out.
Okay, so this is another good point. He's only just now listening to the lungs. So when we do a clinical exam on a patient who's presented to us, there's a kind of a set way that we will approach this. So in the first instance, we're going to be looking from a distance to assess our patient to see how they're behaving, how they're acting, how they're walking, how they're breathing, all these kinds of things which can give us a little clue as to what's going on. We're going to be talking to the client at the same time as we bring them in, finding out what the problem was, and then asking a detailed history. How long has this been going for? Appetite, thirst, toileting habits, vomiting, all of these kinds of little clues that can build up a picture in our heads of what's going on. And actually that history is probably responsible for about 50, 60, 70% even of the information that we receive. So the exam is important, but the history, what you're able to tell us about your pet, is absolutely crucial. When we then jump into an exam, we're going to start typically from head down to tail, from least sensitive area to most sensitive area. So the thermometer is going to be the last thing that we're going to do. We definitely want to be listening to the lungs first, listening to the heart, checking the gums, checking in the mouth, checking the eyes, nose, skin, palpating, feeling that abdomen. We're saving the sensitive things that may cause our patient some discomfort or even pain. We save those to the end.
Don't you touch that.
It's heading in. It's going south for the
I'm not
winter.
sure I'd be grabbing a client's arm like that.
Nancy, I have to interpret.
But hopefully
what
they
the
wouldn't be
dog
grabbing the
is
thermometer
moaning
either.
about.
What's to interpret? There's a thermometer. It's in my butt.
Take it easy, be over a minute.
What?
Yes.
Well, there it goes. But just swallowed it.
Doctor?
Okay, I'm not sure that your butt would ever swallow a thermometer. Things are designed to come out rather than go in, so they'd be pushed out rather than be sucked in. But hey ho, let's see what happens next.
I'm just guessing, but I think you might have just lost your thermometer.
It's gone. All right.
You also would never let go of a thermometer when you're taking the temperature. I mean, with a digital thermometer, you're talking about 10 seconds, but you'd never let it go. It would just fall out. Let's see what he's going to do now.
I have three options. One, I can manually retrieve it.
What's he saying?
That's what you
Option
do.
wants to retrieve it manually.
Pass.
Two, give the dog a laxative and wait it out. And three, surgically.
So a laxative would probably work if something small is in the colon, if it's made its way into the colon, either because it's been swallowed orally or it's been sucked into their bum, then it's going to come out in the vast majority of cases. There's going to be exceptions to that with small bone shards and if there's constipation and that kind of thing. But yeah, he just said surgery, and that's never going to be needed for something like this.
Remove it.
A laxative or surgery?
Laxative.
You know, why don't you
choice.
just give him a laxative? It'll probably come out later on. If it works. So what would you suggest?
So if it never works, you wouldn't have suggested it as an option, and it's going to work.
I'd like to go in manually.
So this is funny. I often say never trust a vet with a rubber glove because you're going to be doing something like this. Now, doing a rectal exam, again, that's something that you would leave to the end. It is something that we do, so we can do that to assess anal glands, to empty anal glands, to check for prostatic disease in male dogs, especially male entire dogs. If there's problems or concerns about constipation or a mass or something like that, then again, we may do a rectal exam. Now, it's not particularly pleasant for our dogs, but for our big dogs, they don't really mind. I mean, you just have to think how big their stool is compared to the size of your finger. For smaller dogs, it can be more unpleasant. And for our toy breeds, it's not something that you'd want to do without sedation or anesthesia, depending on what the problem is. And for cats, again, it's not something that you would do without heavy sedation or anesthesia, because it's just would be far too uncomfortable and painful for them. Thankfully, it's not something that we really have to do on a great deal of patients of those types.
Here we go.
Oh, my Lord. Oh, this is not good. Oh, Lassie, go home.
So the comedy's pretty good, but the accuracy is terrible, and this is definitely not a veterinarian that I'd recommend you taking your pets to. Make sure you check out my other reaction videos linked on screen now. And until next time, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.